Support for Radio Friends comes from OsteoStrong. Improvements in bone density, strength, and power can be achieved by weekly 5-minute no-sweat sessions on their 4-spectrum machines. These isometric robotic machines safely emulate high-impact loading on different parts of the skeletal system, which stimulates activity in bone-building cells. Balance and agility can be improved by 2-minute sessions on vibration plates. Every session is supervised by a trained coach. Learn more on Facebook or call to set up a complimentary wellness assessment and session. Good morning and welcome to Radio Friends on Thursday, March the 4th. I want to introduce you to Dr. Smrita Dorairajan from the VA hospital. Good to have you here, Doctor.
Hi, Paul. It's always nice to be here with a new health tip to share with our friends.
Yeah. Today you wanted to talk about obesity and our kidneys. What's the tie there?
So obesity is getting to be a very big challenge that the world is facing today. So to explain the magnitude of the problem, nearly 1 out of every 3rd adult in the U.S. is obese. And this puts the rate at nearly 40% of adults in the U.S. having obesity.
So what is considered being obese?
So we calculate something called the body mass index,
right,
or the BMI. This is basically your weight in kilograms divided by your height in meters squared. So this number should be between 18 to 25. And when it is 25 to 30, they fall into the overweight category. And when it's above 30, they fall into the obese category.
Okay. What if it's 35 to 40? Is that?
So it's like even more, like morbidly obese.
So there's obese, there's overweight, there's obese, and morbidly obese. So what does it do to our kidneys if we are in the obese category?
So for every fold increase in your BMI, there is nearly a 3 to 5-fold increase in kidney problems. So it can indirectly affect your kidneys because obesity causes the entire host of metabolic syndrome. When you're obese, you're very likely to be hypertensive. You're very likely to develop diabetes mellitus. You're very likely to have cholesterol issues, heart issues, and something called obstructive sleep apnea, where you don't get enough airflow because of the narrowing of the throat. Mm-hmm. So all these can indirectly cause kidney trouble. And also directly obesity can affect the kidneys. This is because the kidneys have to work much harder than in a person who's of normal weight to clear out the toxins. So the kidneys are always working overtime, and eventually this leads to damage of the filtering units in the kidney, and they give way. And you start noticing a lot of protein spilling in the urine and malfunctioning of the kidneys.
Are there any signs that you can pick up yourself, or is it something that only can be detected by your doctor?
So the thing is, the weight you always know. And so it's always very good to keep track of your weight and your BMI and ensure that you are in the healthy range. And now even when you go to the pediatric office, because this obesity issues start early on in childhood, even my daughter, they are tracking and giving a good book and a label and a sticker for being in the ideal body weight, because it's challenging even for kids to now stay in the ideal body weight.
Now, I read an article the other day about the BMI. And what I read was sometimes people who are very muscular, have a lot of muscle, which is weight, can fall into the obese category because of the muscle weight, not because they are fat. How do you tell the difference between the two?
So there are some machines now which can give you the percent composition of your body. So in such muscular people, getting that percentage composition, how much of their body is comprised of fat, how much is protein, this breakdown, the machine is able to give. So a lot of gyms also have this technology, And a lot of hospitals also have. So it's like a body scanner, which gives you the body composition.
Okay.
So when they're not obviously like overweight and it's all like muscle, so such people will have like lot of muscle composition when the breakdown is given. So they need not worry about it.
So what advice do you have for people?
So even a 5% reduction in the body weight can reduce your risk of kidney dysfunction. So even about a 2-pound weight loss in a week is very helpful. So I would say for people to get more conscious about that and get into the ideal body weight, and also portion control, cutting back on the food portions. That is a good thing. Calorie restriction, exercise. Everybody needs to get good amount of exercise. At least 30 minutes of exercise, about 5 days a week. And ensuring good quality of sleep. So sleep is very important. At least 7 to 8 hours of good quality sleep is required as an adult. When you don't get enough sleep, this drives up the stress hormones. And so this can cause hypertension and eventually lead to kidney problems.
When you talk about the exercise, does it have to be strenuous exercise, or what if you just go out for a 20 or 30-minute walk? Does that count?
Yes, it does count because it depends on the age group of the person. Not everybody is able to do very strenuous exercise. So any exercise counts as long as you're getting your heart rate up there. And people with arthritis and older people who really cannot do like running or jogging or even walking may be hard. In such cases, arm exercise. So that also is like helpful.
Anything to keep your body moving.
Yes.
Makes a difference.
Definitely.
And that's going to help our kidneys too.
Yes. The kidneys would be very happy.
Drinking water. Can we drink too much water?
So it depends if you have like kidney trouble, already chronic kidney disease. So you want to restrict to about 2 liters a day. Similarly, if you have heart failure, you may have to restrict to 1.5 to 2 liters a day. But the rest of the people, you can drink to your thirst. So
Okay. So we should have about eight glasses of water a day would be perfect.
Yes.
That's flushing out our kidneys. That can also help to prevent kidney stones.
Yes. Drinking water is the key thing for preventing kidney stones, and also cutting back on salt. Salty food is one of the major problems in US especially. So average American diet has nearly 4 to 6 grams of salt, whereas the recommended is only about 1.5 grams of salt.
Right. You are absolutely amazing, doctor. Just listening to you talk. I appreciate it so much. If people want more information, where can they go?
So we have a program, Heartful Living program at the VA hospital, which is entirely free to veterans and open. So they can contact the VA hospital
All right.
through the rehab program.
Thank you so much for coming by. Okay? Bye-bye.